Hey, are you still suffering from low back pain? Well, today I want to talk about what an actual solution looks like when you come to the clinic and work with me. First, I want to talk about, is back pain the real problem? The area of pain typically isn't the real problem. Yes, it may hurt, and it might be the thing that makes you pick up the phone and call somebody for help. But it really usually isn't the real problem. Now, the people I see, a real problem for pain is something isn't moving or participating like it should. Now, when it comes to low back pain, it's usually the hips, and I've talked about this quite a few times. It's usually the hips, and it can even be the upper back. They're not acting or participating like they should, and what happens is the low back has to take up the slack, so it's overworked. The area in pain is typically overworked because somewhere else isn't working like it should. So, we have to look at the entire body. We have to look at full body movement. We have to look at how you're moving from head to head down to your ankles and see where the problem stems from. The other thing I want to talk about is your diagnosis of the problem. So I get people in the clinic all the time that say, I've been diagnosed with degenerative disc disease, I've been diagnosed with arthritis, spinal stenosis, herniated discs, and what I want to tell you is those things are normal. Yes, they really are. You have, if I were to take an MRI or an X-ray of everybody that watches this video, I bet to say that at least 60% of people would show something on their spine. And if we got people that were 50 years and older, the number would probably go up. It's called normal aging. And it happens on the outside with our skin. You see wrinkles. It happens on the outside. You just can't see it on the inside. But we move. We use our body. We run. We squat. We jump, we use our body. We're in motion. And so if you're a fool to think that your body isn't going to be, it's not going to be worn and torn on the inside as well. But I'm here to tell you that usually just because you find those things on an X-ray and MRI, they're usually not the problem. Because most people are diagnosed with something, but we get them out of pain. So what does the solution really look like when you're working with us? Again, we treat the entire body. We don't just treat the area of pain because we want to be a long-term solution. If you want a short-term solution, we treat pain. If you want a long-term solution, we treat movement. Typically, it's at least the hips that we'll treat, usually the upper back. Obviously, we'll treat the area of pain, but that's just for pain itself. It's usually not the problem. But we'll at least treat 2 or 3 different areas outside of the area of pain, depending on what we find. And mobility always comes first. So it really works in 3 phases. We treat mobility first where we need it. Back up. We treat pain where we need it. And then at the same time as we're treating pain, we treat mobility. Once we get mobility where it's needed, then we stabilize. We do stability. And no, your core strength is not a cause for your back pain. They've shown this. People with strong cores have back pain. People with weak cores have no back pain. Typically, it's an instability problem, which means that your core isn't firing at the right time. It's not working with movement, your arms and your legs. It needs to be retrained. If it is a stability problem, it's not a weakness problem. It needs to be trained to fire in the correct order with movement, which there are exercises for that as well. So here's the truth. I could give you exercises right now in this video. I could say, here's my top 10 exercises for back pain. But the problem with that is I don't know why you have back pain. Yes, I know you're suffering with pain, and there are some solutions I could give you to start getting rid of that, but I don't understand why you're in pain. And if I don't understand why, and I try to give you a solution, I become a part of the problem, and I refuse to do that. I'd much rather be your solution. So, if you would like to know exactly what's causing your back pain, I have an offer for you, a 100% free visit where you can come into the clinic. You click the link around this video, you come in and sit down with myself. It'll be about 40 minutes or so, and we'll talk about exactly what's going on. We'll talk about how long you've been suffering with pain, what you've been diagnosed with, what makes it better, what makes it worse, what you've tried in the past. Because we get people in the clinic all the time that have tried acupuncture, PT, chiropractic, massage, and they just haven't found their solution, and then they're ready for something different, and you will find that we are totally different. We'll look at how you're moving from head to toe during that free visit, and then I'll tell you exactly what I'm seeing. I'll even give you 1 or 2 things that you could start doing immediately, and then I'll tell you what I'm thinking a solution really looks like for you. Now, we typically see people 1 time a week. It's usually about 5 to 8 total visits until we reach their solution. That does depend on how many body parts we're working on, depends on how long pain's been going on, but it's typically somewhere in the 5 to 8 range. Now, if you would like for me to check you out for that free appointment, I'd love for you to click the link around this video, be taken to my website, fill out the form, and then I'll get in contact with you and see how I can help. All right, I will talk to you soon.